They should be calling us all up and saying thank you to cities and counties, because what could have happened in the state of Florida, as far as the number of hospitalizations and the number of deaths, didn't happen because of the actions that cities and counties took, that this legislation directly addresses and would, in vast large part, prohibit us from doing. So I'm going to walk you guys through this a little bit, and I want to encourage everybody, not just reporters, but the public. Pull up the bill and read through it and see what it actually says. The first thing, though, that I thought was very interesting is when you start looking at where it talks about the intent of the legislature. They don't hesitate to talk about the intent on the economy, but nowhere in the list of intent in legislative findings do they talk about the intent to minimize the negative effects to health and safety of communities caused by public health emergencies. To me, that's a pretty notable exclusion that's not in this document. They're more interested in the powers of the legislature and the governor and in businesses and keeping them open than they are in the health and safety of our public. Then as you start scrolling through, and there's a lot of things that are in this bill, but I'm just going to call your attention to several pieces of it. The legislature had no issue in giving the governor authority to enter an executive order, proclamation, or rule that is in existence for 60 days, no more than 60, but may be renewed as necessary. But when it comes to cities and counties, it's 7 days and no more than 42 total. So think about when COVID started and the first orders of cities like St. Petersburg went into effect. And then think that was roughly, let's say, April. So by the middle of May, under this bill that was signed by the governor, the order of the city and the county would have been over. We could not renew it under any right. And it was only good for 7 days, and then city council or county commission would have to renew it and authorize its renewal. So think about the unintended consequences that come with that. Aside from COVID, let's say we have a hurricane and our bridges are washed out, and I put an executive order in place, an emergency order. 7 days later, somehow I got to try and get my council back together in order to extend that emergency order. Otherwise, that emergency order is over. It goes away.
I'm just trying to argue, but he specifically said it was not in, it's an outside of hurricane. He said that. Outside of hurricane, this is in place.
Well, I would encourage the governor to review the order to see what it says here. I'm going to turn to that page. An emergency order automatically expires 7 days after issuance. This is in section section 4. Okay, so he's saying it's only relates to healthcare. So I guess it's not important if you've got several. Let's say you have several council members who have COVID, who have tested positive. How do I get a quorum? How do I extend my emergency order if they're positive, they're quarantining, or they're in the hospital? What do I do? So even if he's right and it doesn't, and I just read this before we came here, but even if he's right and it doesn't, how do you deal with that situation? What are we supposed to do then? How do I have an order in place? The order also I thought was interesting is, you know, in the state of Florida, when you're a school, and I'll use schools as an example. Elementary school through high school, diphtheria, tetanus, Hep B, measles, mumps, rubella, polio, chickenpox. For high schools, HPV, meningitis. Those are all vaccinations you have to get. And they're required if you're going to send your kid to school or high school or college. But now in Florida, COVID-19's vaccination isn't included. You cannot require that. So we have to ask the governor and the legislature, what's the difference? Why is it required for all these other vaccinations, and that's okay, but it's not okay to ask and require a COVID-19 vaccination? And what it comes down to is it comes down to politics. And unfortunately, this administration and this legislature has applied politics to healthcare in the state of Florida. And who loses when that happens? All the residents of the state of Florida. almost 20 million or 22 million or whatever number we're at now. Those are the ones who are losing, by this. So this act, this isn't for the protection of Floridians. This is for politics. And that's not what it's supposed to be. Yes?
So one question that I asked the governor
Mhm.
today, and I'd like to ask you, our city council members, our county commissioners are elected.
Mhm.
And by putting something like this in place, that does allow some checks and balances with the state legislature and the governor, it also gives the governor power to overturn localities. So
Yes.
isn't that contradictory? I mean, what's your view on that?
Yeah, well, the legislature is not shy about hypocrisy. And you listen to them, and if you listen during session, you'll often hear them complain about Washington. Washington shouldn't tell us what to do. We know our state better than Washington. Well, the legislature shouldn't tell local government what to do. We know our cities and our counties better than they do. And so that's what you frequently will hear. The governor there's a lot of language in this that basically gives him total power. And you're right. So we can have an order in place. If the governor doesn't think it's an appropriate order, he can just say, that's it, your order's dead. And so what is he basing that on? There's no requirement that it has to be founded on science, especially when it comes to COVID. It's founded on whatever the governor feels, just like there are provisions in here that even regulate him, but they give him the flexibility where it says that his executive order should, to the greatest extent, and I'll read the one about schools. There's a presumption that schools should remain open as long as health and safety of students can be maintained by specific public health mitigation strategies recommended by federal, or, that's the big word here, or state health agencies. Now, who do state health agencies work for? They work for the governor. So the governor can control the state health agency if he wants businesses open, because that same provision applies to businesses. The state health agency can say, no, it's fine. And he can rely on that, and he can he can put orders in place.
Mayor, do you feel like you have to check with the governor now before you issue a state of emergency?
Well, certainly that seems to be the way that they're trying to do things here. I mean, there's a provision related to if we receive state money for emergency services that says we have to submit to the state within prior to expending funds, what our plan is for how we're going to expend funds. Now, if it's a real emergency and we don't have time to do that, they do give us that exception. But again, it's all about control here, and it's about the state trying to wrestle control and take control away from local government, from the people who are closest to the people who elected them to make the decisions about what's best for our community.
Are there any channels for you to challenge this legally?
I think legally this will be challenged. Look, I spent 6 years in the legislature. I can remember standing on the floor of the House holding up first DCA court opinion and that said that the actions the legislature was about to take, which previously they had tried to take before and was challenged and was found unconstitutional, I'd say, this case says what you're doing is unconstitutional. And I actually had a legislator say, well, that's just one court's opinion. Well, that was an appellate court's opinion. It carries weight. So they don't seem to really care about constitutionality. Think if you want to really look at something interesting, go back and look at how many bills have been passed by the legislature that have been challenged as unconstitutional and have been found to be unconstitutional, and how much money of taxpayer money was wasted.
What does this mean for your enforcement as of today?
Well, this goes into effect July 1, but what I've been told is that he's entering an executive order that puts this in effect immediately. And so, I haven't had a chance to talk with my legal department yet, but my best case scenario would be that the order that I have in place, the order that the county has in place, would be in effect for 7 days and no more than that, before I'd have to go back to my council and the county commission in order to get an extension. And even then, the maximum time is 42 days.
So just broadly speaking, the governor says that he thinks it's important to revisit restrictions, to look at the evidence, and to see whether the continued use is justified. Explain why that's a bad thing.
No, I mean, we do that every time. Every time we renew our executive order or emergency order, both I do it, I know the county does it. I've had conversations with that. We're in consultation with healthcare experts in making our decisions. Real healthcare experts, not, radiologists like I think it's Dr. Frost, or Atlas, Scott Atlas, I think is his name. Yeah, who's not a epidemiologist. He's not a specialist on pandemics, but that's who our governor has listened to. If you're going to listen to experts and weigh your decisions based on experts, talk to guys and gals who are experts in the subject matter. That's what we've done, and that's what we'll continue to do, and that's what we've done all along. I would rather not wear that mask any longer than I have to. I don't want to require anybody to wear them any longer than we have to. But what we've done is we've kept our community safe while at the same time being able to keep our businesses open. We found that balance. That's what we've strived for. And we've done it, and we've done the hard work and the heavy lifting while he hasn't.
With your issue of the language of that aside, what do you say to him saying that there's evidence that it's time to roll these restrictions back? Do you think it's not time?
No, we're not even at 50% vaccination yet in Pinellas County, let alone the rest of the state. And so if that's the case, then why isn't the CDC saying no more masks? Have you heard that from the CDC? The only thing I've heard from them is if you are outside and you're with a small group of people who've also been vaccinated and you've been vaccinated, you don't need to wear this. But when you're in large groups, you should continue wearing this. When you're indoors, you should continue wearing it. That's the CDC. That's not Governor DeSantis. I trust the CDC before I trust Governor DeSantis.
What restrictions does that take away that are in place right now that are not going to be in place once this executive order is issued? Have you had a chance to look at it carefully enough yet, or?
So I haven't yet because this all just happened. But I do know the large-scale event order that the county has in place, that we have in place, the requiring the wearing of masks indoors, the 6-foot separation of tables indoors, the maintaining social distancing that we have in place, all goes away. All of it. Yes.
So he signed three things. I mean, he obviously signed the legislation that came out of the task force, and then signed an executive order that effective on July 1st, local emergency order as well. He also signed effective today the suspension of all local emergency orders. So the people who live in St. Pete right now that listen to him say it's suspended, should they just stop listening to what you say?
Well, if you look at what happened the last time he entered an order, first off, most of the time his orders are very confusing, and all of us, and when I say all of us, I'm talking about mayors and county administrators from all over the state. We've all struggled trying to figure out what his orders are saying because they're not typically very clear. And a lot of times it seems like he holds a press conference and then the order comes out afterward where his staff is probably scrambling to write down what he put down because that seems to be the executive order. But I don't know. If he's suspending all of our orders immediately, then you're going to be able to go into a restaurant and you never have to wear this again. And we can all expect to see our hospitalizations increase. Unfortunately, we'll probably see an increase in deaths, but I guess that's not important. Our businesses, they've been able to hold on because we've tried to find that balance here and keep our community safe. And I think that's happened all over the state of Florida. You look at Mayor Dyer in Orlando. You look at Mayor Castor in Tampa. You look at Mayor Gelber in Miami Beach. You look at Mayor Francis Suarez in Miami. You look at Mayor Curry in Jacksonville. We all had orders that went further than the governor's. That's Republican and Democrat. And that's why you see the numbers that you've seen. And you haven't had the deaths and the hospitalizations in Florida that you've had in other places around the country. Because the mayors and the county administrators took action that he wouldn't take.
Is the 42-day part of this, you think, the worst thing in there? You have no powers after 42 days?
I think it's very problematic. Again, when you think about where we were in the summer months, when you saw numbers in the 9-10% and higher here, and in other parts of the state even higher where they had even less restrictions than we had. Imagine if all of those orders in those cities, if the orders didn't exist and there were no restrictions. What would the numbers have been like? How many people more people would have died? You know, to me, that's important. I care about who dies in my community.
Mr. Mayor, should the public have a choice to wear a mask or not?
So, you know, one of the questions that I find fascinating is you go into a restaurant that has no shoes, no shirt, no shoes, no shirt, no service. Has anyone heard complaints about that? The fact that a restaurant or a business can say that? But for some reason, when we add masks to it, all of a sudden that's a problem. So it's okay for a business to say, you can't come into my business if you don't have shoes on, but I can't say the same thing about you coming into my business if you're wearing a mask. That makes no sense. It's about public safety, it's about health. And unfortunately, what people do impacts other people. And so somebody that isn't wearing a mask that may be contagious and is standing in front of me is putting me and my family at risk. So, yes, ma'am.
Were you totally caught off guard today as a mayor?
Well, we heard not early this morning, but probably maybe an hour before the presser was going to happen that he was going to be here to do some kind of press conference. Had no idea what it was going to be. So yeah, this is the way it typically has happened. Last minute, a lot of times the orders have come down on a Friday at 5, and then our business community turns to us and says, what does this mean? And we look at it and we're trying to figure out, I don't know. I can't tell you how many times I've called the county administrator and I've said to him, do you understand what this order says? And he's like, I'm not sure either. I said, well, I think it means this. He said, I think it does too. We hope that's what it means. But it's always been a struggle throughout this entire pandemic, unfortunately. Yes, ma'am.
My final question. Thank you again so much for coming out and talking with us at this point. The business community here, have you gotten a lot of pushback from them for the restrictions that are, are they unhappy with what's been happening? Or?
The only businesses that have been unhappy about our restrictions are the businesses that have been cited multiple times. We call them the frequent flyers. They've had 5, 6, 7, 8 citations for violating the orders. And by the way, the violations were never about their customers not wearing a mask. Their violations were always about the staff of the business not wearing a mask or not enforcing social distancing protocols. That's what they got cited for. Those are the businesses that have complained to us. And that's a relative few. I mean, when you look at how many businesses there are in St. Pete, I think we were less than 20 that have in the entire city that have received that many violations, and those are the ones who complained the loudest. Everyone else went about their business and did it right because they wanted their customers and their employees to feel safe. All right, thank you all.